Yeah, so CMML is a rare cancer, and rare cancers in general are challenging to develop therapies. I always say, by the National Cancer Institute definition, CMML for sure is a rare cancer. But if you look at all cancers, 30% of all cancers would be defined as a rare cancer, or 30% of patients who have cancer have a rare cancer. And so, I think what is unique to CMML, though, is not only is it rare, but it's gone through a nonlinear classification history where it used to be called another disease, a subset of another disease, namely myelodysplastic syndrome. Then was within the last 15 years decided it was its own disease. And I think that's provided a lot of challenges in that many of the clinical trials include CMML, but are really MDS studies. And there are approved therapies here in the United States that are approved for CMML, but the study was never intended to or powered to determine whether that CMML group was particularly responsive relative to the broader MDS population. And so, rare cancer that has unique challenges, but a rare cancer in which we've jumped around how we call it is even harder.